Can PT prevent opioid use disorder? We are Group 4 and we are presenting to current physical therapists to provide education on the need for their services over opioids and how they can help in this opioid pandemic.
The problem. Musculoskeletal pain plays a huge role in the opioid crisis today as it affects 1 of 2 adults and reports an annual cost of over $800 billion. In 2018, over 160 million prescriptions of opioids were dispensed, and over 46,000 drug-related deaths occurred due to these opioids. Between the years of 2009 and 2013, of the 40,000 patients with acute low back pain, only 1/6 of these patients were prescribed PT within 90 days. Fixing it with the facts. Studies show that patients who report to PT within 3 days have a lower chance of using opioids in the future. PT serves as an alternative to short-term opioid use for acute musculoskeletal pain, so it may decrease total opioid exposure. Studies also show that utilizing PT early on can decrease healthcare costs by preventing further surgeries, injections, and images, and decreases the risk of chronic opioid use.
So why should physical therapists be concerned with these problems? For one, physical therapists aren't being recognized for what they are trained to do. Instead of being utilized for their services, they are getting pushed to the back burner, while opioids take their spot in managing pain. Opioids are only masking the pain in these patients. The underlying problem is not getting fixed with these types of medications. They are merely adding a concern for future problems such as opioid use disorder. Physical therapy works to decrease pain, increase function, and improve the patient's injury. We can't do this unless the medical professionals are giving the patients an order for our services. With that being said, physical therapists should be advocating for their profession to get these patients in their clinic instead of depending on medications to fix the problem. We play a vital role in the opioid crisis by enhancing the health, well-being, and quality of life in our patients.
The role of physical therapists in evaluations. Physical therapists can evaluate individuals for risk factors to prevent future pain. Disease history. Conditions such as cardiovascular disease, osteoporosis, and rheumatologic disease can affect an individual's nociceptive experience. Cognitive and psychological factors. Disorders such as anxiety, depression, fear, and post-traumatic stress disorder can be risk factors for the development of chronic pain. Beliefs. Negative beliefs about one's condition can contribute to persistent pain. And a sedentary lifestyle is strongly associated with immobility and pain. Physical therapists can play a role in the treatment of pain. Physical therapists can help with exercise, manual therapy, stress management, sleep hygiene, and pain neuroscience education. Studies have shown that people who exercise regularly experience less pain. Physical therapists can help develop, administer, modify, and progress exercise prescriptions and programs to address poor conditioning, impaired strength, musculoskeletal imbalances, or deficiencies that may lead to pain. Physical therapists can also provide manual therapy. Manual therapy involves hands-on manipulations of joints and soft tissues to modulate pain, reduce swelling and inflammation, and improve mobility. Research shows that manual therapy techniques are effective at reducing low back pain, discomfort associated with carpal tunnel syndrome, and other sources of pain. Interventions for stress management, such as mindfulness, relaxation, visualization, and graded exposure to stress-producing events, can help patients reduce pain and improve their functional capacities. Sleep hygiene is also important because individuals with persistent pain often complain of sleep disturbances. Evidence has shown that sleep deprivation can increase sensitivity levels and contribute to increased stress and pain. Physical therapists can help educate patients regarding appropriate sleep hygiene to help combat the vicious cycle of persistent pain. Pain science education is also critical. Individuals who don't understand the mechanisms and contributors to their pain may be more likely to seek pharmacological treatment for that pain.
Physical therapists can educate patients about modern pain science that highlights the processes involved in pain.
To end, here's a scenario of a successful physical therapy treatment plan that decreased the use of medications. Cliff is a 63-year-old male with chronic pain from 7 surgeries over the past 8 years. He rates his pain as a 7 out of 10 despite taking daily medications. He has little energy and a loss of appetite. During his exam, the PT learns that Cliff has had several failed surgeries. PT works with Cliff to develop a plan of care to move from pain-centric to function-centric. The team works together to monitor and address withdrawal symptoms while improving Cliff's function without increasing the pain. The team involves Cliff to find what strategies worked or didn't work to gain his confidence and trust. Treatments begin right away, and while the first weeks were hard, he is now able to tolerate exercise without the use of medication. Cliff states the results were unbelievable, and after his treatment, his pain symptoms have decreased by 80%, his energy has increased, and appetite has improved overall.
These are our references. We hope you enjoyed our informative video on the use of physical therapy in treatment of pain opioid disorder.